When delivering an HIV-positive test result, it is essential for providers to be able to convey the information simply and clearly, support the patient's response to the news, provide information about the benefits of medical care, and offer referrals for any additional assistance that may be needed. This video was developed as a resource to assist providers in developing skills in delivering HIV-positive results. In this video demonstration, Lauren, a 32-year-old African-American trans woman, has returned to the clinic where she was recently tested for HIV as part of a healthcare screening. She was contacted by her provider and asked to return to the clinic to learn her HIV test results. This video will demonstrate how to 1. Deliver the HIV test results in person if possible. 2. Help the patient to understand the results. And 3. Refer for medical follow-up and other appropriate services. Hi, Lauren.
Hey.
I'm glad that you were able to come in today and that we can talk in person. I have your HIV test results.
They're positive, right? I know they're positive.
Yes, the test detected the presence of HIV in your body, which means you're living with HIV.
I knew it. I got a positive test result last year at Pride. And I just wasn't in a space where I could deal with it. I had just started a new job. I didn't have health benefits. I was sleeping on a friend's couch and had just started dating my new boyfriend.
Well, it sounds like you had a lot going on. And I'm wondering, now that you've confirmed that you're living with HIV, where are you now in dealing with all this?
I know this may sound crazy, but I just needed to hear it again.
Well, it doesn't sound crazy at all. Everyone processes information in their own way. And it sounds like you had a lot going on then, and now you're in a better space in your life. Now that you know that you are in fact living with HIV, can I share with you some next steps that others have found to be helpful when they learn they're living with HIV?
I'm ready to deal with this. I just don't know how to move forward.
A first step would be getting you connected to HIV care as soon as possible. That way we can do some additional tests to see how your HIV is impacting your health and come up with a plan to treat it. How does that sound?
It sounds good, but will taking HIV meds affect me taking my feminizing hormones?
Oh, that's a good question, and one that I've heard expressed by other trans people starting their antiretroviral treatment. From what we know, harmful drug interactions is not supported by the evidence. The good thing about being connected to medical care is that we can keep track of how your medications are affecting you and adjust if necessary. How does that sound?
That sounds good.
Our goal in getting you connected to care is to get your viral loads to an undetectable level. We know that when a person reaches an undetectable viral load, that they're connected to care, taking their HIV medication daily as prescribed, and that medication helps to keep the amount of the virus in the body very low. We also know that maintaining an undetectable viral load means you have effectively no risk in transmitting the virus to an HIV-negative sexual partner.
So, if I'm in care and taking my medications daily, and I reach an undetectable viral load, you're saying I cannot transmit HIV?
That's what I'm saying. You have to be committed to your HIV medical care and taking your medication daily as prescribed. We call it treatment as prevention, or you may have heard it referred to as U equals U or undetectable equals untransmittable. Reaching an undetectable viral load and knowing that it helps to prevent the transmission of HIV may help to combat the fear people living with HIV have in transmitting the virus to others.
That's amazing to know. You're making me feel hopeful about living with HIV. I was a little worried in the beginning because I haven't had the best experiences with providers.
It's unfortunate that your experiences with your medical providers haven't always been good. And I'm glad you're feeling hopeful about living with HIV. My clinic is fortunate in that I am one of 2 doctors on staff here who specialize in working with trans people living with HIV. If you'd like, we can get you connected to care through our clinic, or if you prefer to work through another clinic, we can certainly help with the referral. Which one of those 2 options work best for you?
I feel like being here would be the best option for me.
Okay, well, let's get you connected to the medical case manager, and they'll schedule a follow-up appointment. They'll also coordinate with your healthcare insurance company or other resources that can help to support your care. Lauren, another step that often comes up with people is how to tell their significant others about their diagnosis. Now, you mentioned your boyfriend. I'm wondering your thoughts on informing him or others who you might want to inform about your status.
Well, me and my boyfriend's been dating for the past year, and he's known about my possible status. And we use condoms all the time, and he's on PrEP.
Well, it's helpful to know that you and your boyfriend have taken thoughtful steps to prevent him from acquiring HIV. If at some point you feel like there might be others who you'd like to inform, we offer free and confidential options to inform them and encourage them to get tested.
Some of my trans sisters feel that becoming HIV positive is inevitable because we're always told about the high rates of HIV in our community. And I just didn't think it was going to happen to me.
Lauren, it's unfortunate that your friends believe that their living with HIV is inevitable, and rates of HIV are high among trans women of color. But the good thing to know is that there are effective treatments to prevent the transmission of HIV or its acquisition. HIV does not have to be an inevitable outcome for trans women.
I know I have a lot to learn, and I'll let my sisters know.
Tell me, who do you have in your life that you feel can help support you when you leave here today?
Well, I have my trans sisters who are living with HIV. I know that they'll have my back. And my boyfriend. He's been encouraging me to get retested since we first started dating.
It sounds like you have people in your life that you can count on to be supportive. If at some point you feel like you want outside care, like individual counseling or peer support group, the medical case manager can help to coordinate that for you. Is it okay if I give you this pamphlet, which has some of the basics around living with HIV and the importance of treatment? Lauren, the most important thing to remember is that treatment works. And it's important that if you're ever unclear about anything your medical team is saying or have concerns about drug interactions, it's okay to ask questions. The more you learn, the more you can advocate for your health.
That's good to know. And I know I'll have some questions at some point.
Okay. I want to check in with you. How are you feeling now about all of this?
I'm feeling good about my decision to get retested and not having to worry about drug interactions. I also liked what you said about the benefit of being undetectable. My boyfriend has known that I could possibly have HIV when we first started dating, and he's on PrEP. And even though we use condoms when we have sex, I don't always feel completely comfortable because I haven't addressed my HIV status.
That's completely understandable, and it sounds like you and your boyfriend have always worked together to protect yourselves. If you'd like to set up a future appointment, we can talk about the benefits of your boyfriend being on PrEP and you reaching an undetectable viral load. And if you'd like some condoms, I can give you some before you leave here today. How does that sound?
That sounds good. Thanks.
Okay, Lauren, let's get you going and connected to the nurse case manager. I'm going to make myself a note to check in with you in a couple of weeks to follow up and see how you are connected with care and to see if you need anything from me that I can help out with. Is that okay with you?
That sounds good. I would really appreciate that.
Now that you have viewed the video, we would like you to think about 1. Which techniques or strategies stood out for you and why? 2. What might you have done differently and why? Delivering HIV test results is a critical step for providers in helping to identify individuals who may be unaware of their HIV infection or at risk for acquiring HIV. It also allows medical care providers to rapidly link those identified as living with HIV into treatment as well as interventions that will prevent transmission and to provide HIV-negative individuals with appropriate risk prevention counseling and interventions. For more resources on delivering HIV test results, please visit